Yesterday, the sitting at the legislature came to a close after 2 weeks, and like everything else right now, it was dominated by the pandemic. Our Adam Hunter joins me now to talk a little bit more about the week that was in politics. And Adam, again, it's all COVID-19.
Yeah, Sam, it's hard to get anything else to get attention at this point inside and outside of the legislature with the pandemic dominating coverage and both what the government's having to talk about and message to the public and what the opposition wants to talk about as well. And we saw that play out of the short fall sitting, a very short sitting, only 2 weeks, and much different looking one with reduced numbers in the assembly, plastic barriers at the desks, everyone in masks, obviously. The government did its typical business, which is introducing bills, getting some measures passed, and putting some things in that they promised during the election campaign. Things like the Sask Power 1-year rebate for bills, a home renovation tax credit, and other measures that they'd want to get done this fall. Many other bills will have to wait for passage in the spring. But Sam, as you mentioned, COVID-19 with daily number changes, we see obviously every day the number of cases is increasing over on an average basis. Hospitalizations are on the rise, ICU admissions are on the rise, the test positivity rate is going up. And the government is being asked a lot of questions about what it's doing, what it's planning to do, and why, from the NDP's point of view, it isn't doing more sooner.
Well, we are about 2 weeks into the 3 weeks of restrictions before they'll be reviewed or renewed or whatever's going to happen. There are some people who are still hopeful that they're going to celebrate Christmas.
Yeah, that's right, Sam. The thought that the premier had last week where he said, we hope that Christmas will be able to happen on a smaller scale. He said that the phrase he used was creep up the gathering limit numbers, maybe allow for visitation to be relaxed in long-term care homes. That was questioned by many, given what's happening in long-term care across the province with the number of cases and also, unfortunately, the number of deaths. And with the gathering limits in the home, as a couple of weeks ago, both Dr. Shahab and the Premier had said that the home was one place where they were seeing COVID spread. He said this week that it would be improbable for them to do that, to make those changes less than a week almost after he was still putting it out there that he was hopeful that it could happen. And yesterday he said that people need to start considering and planning to just have their family, their immediate household celebrating at Christmas. There could be more on that next week, Sam. But in the past, the government has acted before the 2-week period to see if measures are working. They have made changes when they announced mask mandates, for example, in Regina, Saskatoon, and Prince Albert. They only waited a few days before making that province-wide. So there is precedent for them to act sooner. But Scott Moe and Paul Merriman, the health minister, and Dr. Shahab have all said they're wanting to see how these measures play out. They're going to give them an extra few days. The restrictions that were announced on November 27th, Sam, were given a 3-week expiry date. So we could see next week perhaps those extended. Scott Moe says that it could be status quo. We could see the same measures put in place with maybe some stronger messaging, or they could maybe, as he said, tweak the existing restrictions. And we saw this week, obviously, Alberta go a few steps further than what Saskatchewan's done as far as closing some businesses, some places people can gather, public places as well, and even gathering limits outside, which they've restricted in some areas. So lots to think about, lots for the government to consider, and we should expect an announcement, I think, early in the week with some of those new changes taking effect at maybe the end of the week.
And before I let you go, Adam, I do want to touch on the vaccine because all eyes are what's going to happen with that.
Yeah, the vaccine, that was the big news as well this week, where the government announced that Saskatchewan's plan to roll out the vaccine will first be the what is known as the Pfizer vaccine. For most people, that's the one that was approved this week by Health Canada. It's going to be given in a pilot project to first people covering COVID-19 on the front line. So people in emergency rooms, testing centers, in hospitals, in COVID units in Regina at the hospitals. First of all, there'll be 1,950 people covered. And then later this year and into the new year, 202,000 doses the government expects to get of the vaccine, and that then will go and expand on to the high-risk populations, people in long-term care, those over 80, and then trickling down to the larger population in the spring when more vaccine is made available. And of course, the government says this can all depend on how much vaccine they get. They could get more sooner, and there could be more candidates approved. There's still a couple more in the pipeline from Health Canada that may be approved, which could increase Saskatchewan's stockpile and get people vaccinated sooner. Earlier this week, the health minister for Canada said that she expects anyone who wants a vaccine to be able to get one by September. So that's the news on the vaccines, as you mentioned, Sam. So a bit of a good news there as we're trying to start to see the end of the pandemic, but still obviously a long ways to go.
All right. Thanks for this, Adam.